When do I create a patient care report? Now, I bet a lot of you think you know this already, but you're going to learn something before the end of this presentation. There are some of you that like to study protocol, but a lot of you need to look at your protocols more often. There is a lot of stuff in there that you may not be aware of, and you are responsible to know this. So, I'm going to do you a favor. Protocol 7-15, patient care records. When do we have to do a report? Well, if we arrive on the scene, we must complete a report. This goes for everything, emergency and non-emergency. Interfacilities, refusals, no patient contact, etc. If you make the scene, you owe us a report. If no patient is located, or if another EMS agency cancels you on the scene before you make patient contact, the form you fill out will be abbreviated by selecting in a unit disposition, no patient contact or no patient found. When you choose this, you don't have to include vital signs, assessment, patient information because there was no patient contact. You do have to do a narrative, but the narrative can be abbreviated as well. Simply state your dispatch information and your appearance or arrival information and state what you found or didn't find. However, if you encounter a patient, you must complete a full PCR, including an assessment, patient information, vital signs, etc., even if it's a refusal. This can sometimes be a sticky issue, especially when you have multiple patients on the scene. But protocol is clear on this. You must complete a PCR on each patient on that scene. No exceptions. This means any patient encounter is either going to be a transport or a refusal of care. There is no gray area. We used to do what we call citizen assists. Sometimes someone would call us and say, hey, I'm fine, but I just can't get up this flight of steps. Or I can't get out of bed and go to the bathroom. In the middle of the night, nobody will help me. Sometimes we will send a unit to go assist that patient. Previously, crews believed, well, the patient had no complaint. We don't have to do a report because they're not really a patient. Well, protocol has removed that ambiguity. Now, we have a citizen assist, lift assist protocol, which states you must obtain a full set of vital signs on this patient, collect patient information, and get a refusal of care signature from the patient. Another area where there's some confusion is evidentiary blood draws. When you do an evidentiary blood draw, you must do a full assessment of the patient, including vital signs, even if they have no medical complaint. You also must have the patient sign a refusal of care. Now, the irony is that a refusal of care normally requires a competent person to refuse care. Patients who are intoxicated can't sign a refusal of care normally. In this case, it's acceptable to have the police officer sign the refusal of care because they are retaining custody of the patient. If you have any doubt, call medical control. Now, the Protocol 7-15 patient care record says that each agency must complete a report. But what if there are multiple units from the same agency on the scene? Who does a report, or do they all have to do a report? Well, the answer is it depends. If the fire department shows up on the scene, they must do a report. They are stuck by the same protocol you are. If an ALS unit and a BLS unit respond, and the BLS unit arrives first and begins to render care, the BLS unit must do their own report up to the point where the ALS unit arrived and took over patient care. ALS is always going to be doing the report. There's no getting out of it for the ALS unit. even if the ALS unit assesses the patient and determines that they are safe for BLS transport, the ALS unit, per protocol, still must do a report. The BLS unit, who are going to be taking over patient care and transporting, must do their own report. The only circumstance in which 2 units respond but only 1 unit does a report would be if ALS beat BLS to the scene, or if BLS arrived at the same time as ALS. In this situation, BLS is simply assisting ALS, and ALS should document all patient care and any contributions made by the BLS unit. If you have multiple agencies on the scene and you have a patient refusing care, one agency cannot absolve the other agency from doing a refusal of care. Both agencies must complete a refusal of care report and obtain a patient signature. EMTs who arrive on the scene ahead of ALS may cancel ALS before they arrive, as long as both EMTs are comfortable with the situation and find that patient care is within their scope of practice. Otherwise, ALS must always complete their own patient care report on each response. It's either going to be no patient contact, refusal of care, transfer of care to the BLS unit, or a transport. In cases where ALS wishes to transfer care to a BLS unit who is willing to accept that transfer of care and complete the transport, ALS still must do their own independent patient care report. BLS will also do their own patient care report for the transport. Furthermore, ALS must contact the hospital and give report, as well as notify the hospital of the transfer of care to the BLS unit. So after all this, you might be thinking, why is this important? Why is it necessary to do a report on a patient who is completely fine and has no complaint? Well, the fact is, patients can change their stories. And if we don't have documentation in place that establishes what we did, what we heard, what we said on that scene, then afterwards, memories become very flexible. Patients can make allegations. If you think it hasn't happened, think again. If you guys have any questions, concerns, objections, I'm all ears, but the protocol is very clear. Thanks for listening.